Okay, so we will be performing joint manipulations on the wrist complex. The resting position of the wrist complex is slight palmar flexion and slight ulnar deviation. This is achieved by placing a wedge underneath the patient's wrist and a towel for extra comfort and support on top of the wedge. Due to the convex on concave relationship, rolls and glides will be in opposite directions when performing the joint manipulations. So the first manipulation we will be performing is distraction. So you're going to take one hand, stabilize proximal to the wrist joint, take your other hand and mobilize distal to the wrist joint. Make sure that wrist is in the resting position and perform your traction. If the patient presents with restricted extension, we can do a Palmar glide joint manipulation. So stabilizing proximal to the joint, mobilizing distal to the joint, distract, and push down into the plinth in a Palmar direction, and perform your graded oscillations as necessary. So we will be doing a dorsal glide if the patient has restricted palmar flexion. Stabilize proximal to the joint, mobilize distal to the joint, distract, push down into the plinth, perform your graded oscillations as necessary. So if the patient presents with restricted radial deviation, at the patient's thumb facing upwards, and we're going to be pushing down into the plinth. So stabilize proximal to the wrist joint, mobilize distal once again, make sure the wrist is at the edge of the wedge, distract, push down into the plinth. Okay, and if the patient presents with restricted ulnar deviation, there we go. Once again, have the wrist at the edge of the wedge and try to maintain the resting position as best as possible. Stabilize proximal to the wrist joint, mobilize distal to the wrist joint, distract, and push down into the plinth. Perform your graded oscillations as needed.